not a infection control in the health setting. What is that? Infection control in health setting. Understand? So we also discuss the meaning of infection, like the pathogen entry. Which type of pathogen here? Harmful. Pathogen nothing but what? Harmful microorganisms that enter to body, that multiplication, that also what destroying to cells of the tissue. What destroying to cells of the tissue of the host, that we call the infections. So here also discuss some types of infections, right? Approximately how many types are there? 16 types of infection we discussed, right? At the previous class. Today we discuss infection at the hospital. Understand? Infection occur in the hospital. What is that we call that one? Which infection? Infection occur in the hospital. What is that? Nosocomial infection. See the what types of infection in that is there. In the types of infection, nosocomial infection, that infection occur in the hospital. So today we will discuss that one. Hospital acquired infection, that are nosocomial infections. Nosocomial infection. So here first the definitions. Nosocomial infections are nosocomial infections are infections which occur infection which occur as a result of treatment in the hospital. As a result of treatment in the hospital. Understand? But secondary to the patient's original conditions. But secondary to the patient's original condition. To the patient's original conditions. To the patient's original conditions. Here what? One patient. Origin condition is different. Listen here. Origin condition is different. He went to a hospital. For the why purpose he went to hospital? For the treatment, right? He want to take the treatment for the that first primary infection. But what happened? After he admitted in the hospital? After he admitted in the hospital, he get the new infection in the hospital. Understand? He get new infection in the hospital. So first example, if he is suffering from the urine infection, he suffers from what? Urine infection of the primary. What happened to urine infection? That goes complicated, and what doctor advised to him, admitted in the hospital. What he get admitted for the treatment purpose. But after the 4 to 3 days, what happened? Another infection. Which one? Another infection. It may be the respiratory infection. It may be a common cold. Understand? It may be a common cold. It may be a respiratory infection. He suffered in the second time in the hospital. So what is that? That is a nosocomial infection. The secondary. What respiratory system is that respiratory infection that occurs in the hospital. That we call the nosocomial infection. UTI is not a nosocomial infection because UTI is suffering the already. Your infection he suffer from what already, but he get admitted for the treatment of UTI. But after what happened, he get new infection in the hospital. That is what respiratory infection, right? That type of infection we call nosocomial infection. Understand this one? Okay. These are definitions. Next is the causes of nosocomial infections. What are the cause? How we get infection in the hospital? which may be the cause ಏನು ಇರಬಹುದು ಏನು ಕಾಸ್ ಇರಬಹುದು ಆ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಸೆಕೆಂಡರಿ ಇನ್ಫೆಕ್ಷನ್ ಆಗುತ್ತೆ ಕ್ಲೀನ್ ಮೇಂಟೈನ್ ಮಾಡಿರಲ್ಲ ಡಸ್ಟ್ ಮೇಂಟೈನ್ ಮಾಡಿರಲಿಲ್ಲ ಅರ್ಥಾಯ್ತಾ they not maintain the cleanness they not maintain the dusting right they not maintain the hygiene understand who don't maintain the hygiene in the hospital side it may be the staff right it may be the housekeepers right it may be the paramedical staff it may be the OT staff it may be the doctors right no one can maintain the what hygiene so that lead to nosocomial infection understand so it may be the nosocomial infection causes what first the staff right in the staff all are there nursing staff it may be the paramedical staff it may be the lab technicians are there whatever all the staffs right second thing is that in the hospital there is a equipment there is what equipment understand beds then bed pan the glasses the water facility and what tap water in the what toilet is not meant to clean right and also what in the pharmacy there is what not proper dust right so there all are also cloth whenever the patient wearing cloth right some hospital what there is a color coding for the nurses separate color what cloth and also what for the patients also patient to wear some of cloth right so if they contaminated one patient wear the same cloth and also that cloth he wears to second person what is that infection travel one patient to another patient in the hospital where is that in the hospital that infection we call nosocomial infection understand first it may be the staff how the staff one of nurse he handling one of patient right after that the same nursing staff he also handle to another patient so here what happen if she not hand wash if you not change the gloves if you not change the whatever cloth is there you not change what happen the same without hand washing he touch to another person so there contamination hand then also what touch to another person what happen the cross infection be takes place in the hospital right due to what staff understand here in the hospitals two cause one is a staff second is a instrument of what equipment right all are the equipment understand this one here is a cause of nosocomial infection two cause nothing but what variety here staff means of all the staff equipment means what all the equipment understand that lead to infection to secondary to the patients and sometimes what happen staff also get the infection in the hospital not only patient right not only patient only infection only patient no we are staff in the hospital we handling to what patients that infection from patient we infected so also that which type of infection nosocomial infection so that time we also protect to ourselves and also protect to patient and also protect to other patients right all are things we do in the hospital next which one modes of transmission infection right now first is a contact modes of transmission nothing but what transfer right transfer ಆಗೋದು one place ಇಂದ another place ಒಂದು ಯಾವುದು place here one patient ಇದೆ one is patient and also one number 8 one patient right he infect to another person means what patient he also able to infect staff right he also infect to staff patient staff equipment right here what is that the contact method patient to ನಾವು patient ಗೆ infection ಮಾಡಬಹುದು ಆ patient staff ಗೆ infection ಮಾಡಬಹುದು ಆ patient equipment infection ಅನ್ನಲ್ಲ but ಆ infection agent ಇರುತ್ತಲ್ಲ ಆ equipment ಮೇಲೆ ಇರಬಹುದು ಆ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಬಹುದು ಸ್ವಲ್ಪ ಇದೆ ನಾನು ಕಫ್ ಮಾಡಿದೆ ಸ್ನೀಸಿಂಗ್ ಮಾಡಿದೆ non bacteria or surface here right if anyone can touch that surface what happen mild infection that travel toward one of surface. That surface was travel to another. Understand? Surface nothing but microbes, pathogens, right? So it may be that way. So here how ಯಾವ ತರ ಟ್ರಾನ್ಸ್ಮಿಷನ್ ಆಗುತ್ತೆ ಪೇಷಂಟ್ ಇಂದ ಪೇಷಂಟ್ ಗೆ ಹೋಗುತ್ತೆ ಓಕೆನಾ ಬಟ್ ಯಾವ ತರ ಆಗುತ್ತೆ ಅದಕ್ಕೆ ನಾವು ಮೋಡ್ ಆಫ್ ಟ್ರಾನ್ಸ್ಮಿಷನ್ ಅಂತೇವೆ ಸೊ ಇದಕ್ಕೆ ಬೈ ಥ್ರೂ ದ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮೆಥಡ್ ವಿಚ್ ಒನ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮೆಥಡ್ contact in the contact which type so here contact method by the contact method hands or clothing contact method one patient to one patient by the contact it may be the handshaking right it may be the talking it may be the changing of cloth one patient to another patient by the contact method by the clothing in the contact clothing or by the touch direct contact will work direct to contact so ಇದರಲ್ಲಿ two ಬರ್ತವೆ in the contact method ಅಲ್ಲಿ hands or clothing hands or clothing hands nothing but touch hands nothing but what touch who touch here one patient touch to another patient right okay clothing nothing but what one patient wear the cloth the same cloth wear the same patient another patient right that is a by contact transmission understand by the contact transmission next is a airborne next is what airborne airborne nothing but what through the air airborne nothing but what through the air so here airborne write down in the airborne but same here one is a patient okay patient he able to transmit to the patient he able to transmit to the staff right he able to transfer the infection to the object is the equipment right patient so here first is a contact method in the by the contact hands to or cloth one second what airborne ಅಂದ್ರೆ airborne droplets dust aerosols droplet dust aerosol here droplet is sneezing the coughing and sneezing both coughing and sneezing after sneezing the same droplet travel who the person is the front of that that person ಮುಂದೆ ಜೋರಾಗಿ ಸ್ನೀಸ್ ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ ಆ ಡ್ರಾಪ್ಲೆಟ್ ಸೀದಾ ಆ ಮಕ್ಕ ಮೇಲೆ ಹೋಗುತ್ತೆ ಅರ್ಥ ಆಯ್ತಾ ದಟ್ ಇಸ್ ವಾಟ್ ಡ್ರಾಪ್ಲೆಟ್ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಸೊ ನೆಕ್ಸ್ಟ್ ವಾಟ್ dust is what in the hospitals floor ಕೆಳಗೆ ಫ್ಲೋರ್ ಇರ್ತವಾ ಫ್ಲೋರ್ ಡಸ್ಟ್ ದೆನ್ ಬೆಡ್ ಮೇಲೆ ಡಸ್ಟ್ ಇರುತ್ತೆ ಆ ಡಸ್ಟಿಂಗ್ ಮಾಡಿರಲ್ಲ ಚೇಂಜ್ ಮಾಡಿರಲ್ಲ ಬೆಡ್ ಕ್ಲಾತ್ ಚೇಂಜ್ ಮಾಡಲ್ಲ ಅದನ್ನ ಡಸ್ಟ್ ಇರುತ್ತೆ ಎಷ್ಟು ಪೇಷಂಟ್ ಬಂದು ಹೋಗಿರ್ತಾರೆ how that so many patient comes and goes in that same bed but not changing the cloth one second what there is a floor there is what sneezing frequently coughing sometimes also patient sleeping in the floor patient attendants also sleeping in the floor right so these all the sometimes contaminated will be the blood will be lost on the floor sometimes what happens vomiting right that on the floor sometimes what happens lose motion suddenly that on the floor so floor is the most contaminated floor is what here most contaminated after not dusting that dust that enter in the nose same dust was in the floor same dust on the bed same dust on the patient cloth that was enter into the nose that get the infection so here patient infection by the dust to the patient does nothing but the floor dust here I said what floor dust or what bed dust or cloth dust that one person to another person right it may be patient it may be staff it may be the objectives right that next is a oral route oral route nothing but what we medications taking in the hospitals right contamination medication nothing but what the same place we sitting and eating right where place floor commonly some medication will what fall in the floor and same medication we taking understand another we touching some surface in the hospitals. It may be the bed, it may be the what glass. All are using that same glass, right? And that glass is touching, and also same hand we taking the pills. Here, front of that only glass is there, right? Or that glass, and I am taking the what pills and a tablet. The same hand contamination I am taking, and what that taking the tablet. After the same hand, I also drinking the water. Understand here? So here, what happened? The contamination had that touched to the pills. That pills enter the body. Infections, right? And also the glass. We touch all the what? How much patients are? The same I am what drinking the water from the glass. Which type glass here? Contaminated. So here that oral route get in the infection in the hospital through the various types. It may be through the medication, and also we eating the food in the hospitals. Eating food in the hospital that lead to what? Oral route infections. Oral is what? Orally. Route is what? Way. Route is what here? Way. That way. Which type here? Infection way. Infection enter ಆಗುತ್ತದೆ. ಅರ್ಥ ಆಯ್ತಾ? That is the oral route infection will nosocomial ಆಗುತ್ತೆ. Next is the parenteral route. What is parenteral route? Parenteral route nothing but what? Outside the alimentary canal. ಬಾಯಿ ಒಂದು ಬಿಟ್ಟು mouth ಒಂದು ಬಿಟ್ಟು except that mouth all route we consider the parenteral. Understand? Except mouth ಒಂದು ಬಿಟ್ಟು mouth one ಬಿಟ್ಟು ಮಿಕ್ಕಿದ ಎಲ್ಲಾ ರೂಟ್ parenteral. How? Skin is a parenteral. Medicine ನಾವು two way ಅಲ್ಲಿ ಕೊಡ್ತೇವೆ. Medicine two way we have to understand. One way orally. One way what? Orally. Oral ಬಿಟ್ರೆ ಮಿಕ್ಕಿದ್ದು ಯಾವುದು ಎಲ್ಲ ಇರ್ತವೆ ಅದು parenteral. Oral ಬಿಟ್ರೆ ಏನಾಗುತ್ತೆ? ಸ್ಕಿನ್ ಇರುತ್ತೆ. ಸ್ಕಿನ್ ಗೆ ಇನ್ಸುಲಿನ್ ಇಂಜೆಕ್ಷನ್ ಕೊಡ್ತೇವಾ, ರೈಟ್? ಐಸ್ ಇದೆ, ಐ ಮೇಲೆ ಡ್ರಾಪ್ಸ್ ಹಾಕ್ತೇವಾ. ಕಿವಿ ಇದೆ, ಕಿವಿಯಲ್ಲಿ ಡ್ರಾಪ್ಸ್ ಹಾಕ್ತೇವಾ, ರೈಟ್? ನೋಸ್ ಇದೆ, ನೋಸ್ ಅಲ್ಲಿ ಕೂಡ ಡ್ರಾಪ್ಸ್ ಹಾಕ್ತೇವಾ, ಅರ್ಥ ಆಯ್ತಾ? ದೆನ್ ವೇನ್ಸ್ ಇದೆ, ವೇನ್ಸ್ ಕೂಡ ಇಂಜೆಕ್ಷನ್ ಹಾಕ್ತಿವಿ, ರೈಟ್? ಆರ್ಟರಿ ಇರುತ್ತೆ, ಆರ್ಟರಿ ಕೂಡ ಇಂಜೆಕ್ಷನ್ ಹಾಕ್ತಿವಿ, ರೈಟ್? ಹಾರ್ಟ್ ಇದೆ, ಸಮ್ ಡೈರೆಕ್ಟ್ ಹಾರ್ಟ್ ಗೆ ಇಂಜೆಕ್ಷನ್ ಹಾಕ್ತಿವಿ ಅಟ್ ಆ ಕ್ರಿಟಿಕಲ್ ಟೈಮ್ ಅಲ್ಲಿ, ಅರ್ಥ ಆಯ್ತಾ? ದೆನ್ ಏನಾಗುತ್ತೆ? ಲೂಸ್ ಮೋಷನ್, ಜ್ವರ ಜಾಸ್ತಿ ಬಂದೆ ಒಂದು ಪಿಲ್ಸ್ ಇಡ್ತೇವೆ ಮಗುಗೆ ಆ ಮೋಷನ್ ಜಾಗದಲ್ಲಿ, ಯಾವ್ದ್ರಲ್ಲಿ? ಮೋಷನ್ ಜಾಗದಲ್ಲಿ. ಕ್ಲಿಯರ್? ಎಕ್ಸೆಲ್ ಮಾಡಿದ್ರೆ ಒಂದು ಅಪೋಸಿಟರಿ ಫಾರ್ಮ್ ನಲ್ಲಿ ಇರ್ತೇವೆ, ರೈಟ್? ಮತ್ತೆ ದೆನ್ ಕೆಲವರಿಗೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಲೇಡೀಸ್ಗೆ ಕೂಡ ಮೋಷನ್ ಜಾಗದಲ್ಲಿ ಪಿಲ್ಸ್ ಇಡ್ತೇವೆ ಫಾರ್ ದ ಡಿಕ್ರೀಸ್ ದ ಪೇನ್ ಅಂಡ್ ಆಲ್ಸೋ ಡಿಕ್ರೀಸ್ ದ ಫೀವರ್. ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್? ಇನ್ ದಟ್, ಸೊ except the oral route, considering all other route was parenteral, outside the alimentary canals, right? So here during the administration of injections, right? We know proper hygiene. That I want to administer iron injection on a patient, right? Without the swabbing, if a direct take, what happen here? Infection agent that travel to body. ಇಲ್ಲಿ ನಾವು ಎಕ್ಸರ್ಸೈಸ್ ಹಾಕಬೇಕು. ಇಲ್ಲಿ ನಾವು ಎಕ್ಸರ್ಸೈಸ್ ಹಾಕಬೇಕು. ಏನು ಮಾಡಬೇಕು? ಫಸ್ಟ್ ಆ ಜಾಗ ಏನು ಮಾಡಬೇಕು? ಡಿಸ್ಕಂಟಾಮಿನೇಟ್ ಮಾಡಬೇಕು. ಡಿಸ್ಕಂಟಾಮಿನೇಟ್ ಅಂದ್ರೆ ಏನು? ಕಂಟಾಮಿನೇಷನ್ ಎಲ್ಲ ರಿಮೂವ್ ಮಾಡಬೇಕು. ಯಾವ ತರ ರಿಮೂವ್ ಮಾಡ್ತೀರಾ? ಸ್ಪ್ರಿಟ್, ಸ್ವಾಬ್, ಆಲ್ಕೋಹಾಲ್ ಬೇರೆ ಎಲ್ಲ ಇರುತ್ತೆ, ಸೊ ಅದಕ್ಕೆ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಏನಕ್ಕೆ? ಡಿಸ್ಕಂಟಾಮಿನೇಟ್ ಮಾಡೋಕೆ. ಅರ್ಥ? ಕೆಲವರು ಕೇಳಿದ್ರೆ ಸೇಮ್ ಕ್ವಶನ್, ಏನಕ್ಕೆ ಯೂಸ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ ಅವರು ಆ ಬೇಗ ನರ ಕಾಣಿಸುತ್ತೆ ಅಂತಾರೆ. ಕೆಲವರಿಗೆ ಸೇಮ್ ಕ್ವಶನ್ ಕೇಳಿದ್ರೆ ಏನಕ್ಕೆ ಯೂಸ್ ಮಾಡ್ತೀರಾ? ಇಲ್ಲ ಸರ್ ಅದು ಬೇಗ ನರ ಕಾಣುತ್ತೆ, ಇಂಜಿನ್ ಹಾಕಿ ಈಸಿ ಆಗುತ್ತೆ. ಬೇಗ ನರ ಕಾಣಲ್ಲ, ಏನಾಗುತ್ತೆ? ಸರ್ಫೇಸ್ ಫ್ರೀ ಫ್ರಮ್ ದ ಮೈಕ್ರೋಬ್ಸ್. ಸೊ ಅವಾಗ ಇನ್ ಕೇಸ್ ನೀವು ಎಕ್ಸರ್ಸೈಸ್ ಹಾಕಿದ್ರೆ ಏನಾಗುತ್ತೆ? ಅದು ಇನ್ಫೆಕ್ಷನ್ ಆಗಲ್ಲ. ಸೊ parenteral route ಏನಾಗುತ್ತೆ? Unhygienically we practice the medications, unhygienically we practice the administration of injections. What happen? That lead to parenteral route infection ಆಗುತ್ತೆ. ಅರ್ಥ ಆಯ್ತಾ? ಇನ್ನೊಂದು ಸೇಮ್ ಪೇಷಂಟ್ ಇಂಜೆಕ್ಷನ್ ಅದೇ ಇಂಜೆಕ್ಷನ್ ಯೂಸ್ ಮಾಡಿದ್ರೆ ಇನ್ನೊಂದು ಪೇಷಂಟ್ ಗೆ ವೆರಿ ಡೇಂಜರಸ್. This is all about mode of transmissions, right, in the hospital side. Understand sir? Now types of infection in the hospitals. So UTI, common UTI ಏನಾಗುತ್ತೆ? In hospital ಅಲ್ಲಿ ಆಗುತ್ತೆ. ಏನಕ್ಕೆ? Why? Due to the using of the same toilet, right? Not different toilet for the patient. Same toilet we use staff, same toilet we use patient, same toilet we use what? Patient attendant. So what happen here? UTI chance will be the more. Understand? If when you don't wash the toilets, ಫ್ರೀಕ್ವೆಂಟ್ಲಿ ಟಾಯ್ಲೆಟ್ ವಾಶ್ ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ ಅದೇ ಇನ್ಫೆಕ್ಷನ್ ಏಜೆಂಟ್ ಅದೇ ಸರ್ಫೇಸ್ ನಲ್ಲಿ ಇರುತ್ತೆ. Then is a respiratory infection, right? The same what all are coughing, same are coughing, sneezing, they what not manage hygienic, right? So here respiratory infection is the more. If AC no use ಮಾಡಲ್ಲ, ಫ್ಯಾನ್ ಯೂಸ್ ಮಾಡಲ್ಲ, ಅಷ್ಟು ಇದರಲ್ಲಿ ಇರಬೇಕಲ್ವಾ. ಇವಾಗ ಇದೇ ಗ್ರೂಪ್ ನಲ್ಲಿ 2-3 ಮಂತ್ ಜಾಸ್ತಿ ಸ್ನೀಜಿಂಗ್ ಜಾಸ್ತಿ ಕಫ್ ಮಾಡಿದ್ರೆ ಆಗುತ್ತೆ, ಅದರಲ್ಲಿ ಇರುತ್ತೆ ಅದು. ಇದು ಈ ರೂಮ್ ನಲ್ಲಿ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಇರುತ್ತೆ. ಸೊ ಅದೇ ನೀವು ಏನು ರೆಸ್ಪಿರೇಟ್ ಮಾಡಿದ್ರೆ ಸೇಮ್ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಎಂಟರ್ ಟು ಯುವರ್ ಬಾಡಿ, ರೈಟ್? So that happen in the same ward. That happen in the same ward, female ward, general ward, whatever, right? That is respiratory tract infection. Next are wound and skin sepsis. So here the incidence of the post-operative infection is higher in the elderly patient. Most common infection manifest within the week of surgery. After the surgery, ಸ್ವಿಚರ್ ಆಗಿರ್ತಾರೆ, ರೈಟ್? ಆ ಸ್ವಿಚರ್ ಕೂಡ ಹೀಲ್ ಆಗಲ್ಲ, ಅದೇ ಸ್ವಿಚರ್ ಮುಖಾಂತರ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಎಂಟರ್ ಆಗುತ್ತೆ. ಸೊ ಅದೇನು ಸೆಪ್ಸಿಸ್ ನಲ್ಲಿ ಕನ್ವರ್ಟ್ ಆಗುತ್ತೆ. After the post operative, if not maintain the dressing correctly, not maintain the hygiene correctly, what happen? The suturing, that will be the infection one way, ಅಲ್ಲಿ sepsis ಆಗೋದು ಚಾನ್ಸ್ ಇರುತ್ತೆ, ರೈಟ್? So here wound and skin sepsis. Next, gastrointestinal infection, like the contaminated food, contaminated water that you drink in the hospital, that suffer the what gastrointestinal tract infection, the food poison, right? Diarrhea, vomiting, loose motion, all kinds of. So these all the concerns of the gastrointestinal infection. Then burns. Next, the burn. Parents of the hospital acquired infection in the case of burn. Something was burn. ಒಂದು ಬರ್ನ್ ಪೇಷಂಟ್ಗೆ ಅವ್ರಿಗೆ ಕ್ಲಾತ್ ವೇರ್ ಮಾಡಲ್ಲ. ಸ್ಪೆಷಲಿ ಬರ್ನ್ ಪೇಷಂಟ್ ಏನೋ ಒಂದು ಇನ್ಸಿಡೆನ್ಸ್ ಆಯ್ತು, ಮನೆಯಲ್ಲಿ ಏನೋ ಜಗಳ ಆಯ್ತು, ಸುರ್ಕೋತಾರೆ, ರೈಟ್? ಸೊ ಅದ್ರ ಮೇಲೆ ಏನಾಗುತ್ತೆ, ಹಾಸ್ಪಿಟಲ್ ಅಡ್ಮಿಟ್ ಮಾಡಿದ್ರೆ ಅವರಿಗೆ ಕ್ಲಾತ್ ವೇರ್ ಮಾಡಿಸಲ್ಲ, ಓಪನ್ ಇರುತ್ತೆ. ಬಾಡಿ ಓಪನ್ ಆದ್ಮೇಲೆ ಹಾಸ್ಪಿಟಲ್ ಆಲ್ ಆರ್ ದ ಇನ್ಫೆಕ್ಷನ್ ಏಜೆಂಟ್ ಇದ್ದಿರುತ್ತಲ್ವಾ, ಅದೇನಾಗುತ್ತೆ ಓಪನ್ ಬಾಡಿ ಡೈರೆಕ್ಟ್ ಎಂಟ್ರಿ ಆಗುತ್ತೆ. ಓಪನ್ ಬಾಡಿಯಲ್ಲಿ ಡೈರೆಕ್ಟ್ ಎಂಟ್ರಿ, ರೈಟ್? ಸೊ ಬರ್ನ್ ಬೆಡ್ ಸಪರೇಷನ್ ಬೆಡ್ ಇರುತ್ತೆ, ಅವ್ರಿಗೆ ಕ್ಲಾತ್ ವೇರ್ ಮಾಡಲ್ಲ, they all empty. So here how on a bed is there, right? Our bed crawler, bed crawler, okay? Main agata bed crawler anta irutte, right? So that is used in the hospital. If that contaminated my pathogens enter to body, because burn wound irutte direct enter agutte, right? Chance are more. Next is a bacteria and septicemia, right? Long cannula 3 to 4 days long ide, up to 6 days is there. So that is a cause of one of them, right? Enter a chance. Then catheter is there, remove madilla after 50 days aito, that will confirm more, right? So bacteria whatever one procedure madidare but long expired agide, but adu remove madilla enagutte ಆ ವೇ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಎಂಟರ್ ಆಗೋಕೆ ಒಂದು ವೇ ಆಗುತ್ತೆ. That is what bacteria and septicemia, that bacteria enter into body and that become what septic. Understand this one? It's all the types of nosocomial infection in the hospital, right? We will go next is a diagnosis and control. How to diagnose that? Diagnosis, first we make a team. First what? We make a infection control team in the hospital. In that, one is a microbiologist. In that what? One of microbiologist is. Then no, hospitals nali ಸರ್ಫೇಸ್ ಇರ್ತವೆ, ಚೇರ್ ಇದಾವೆ, ಆ ಚೇರ್ ಕೆಲವೊಂದು ಸ್ಯಾಂಪಲ್, ಜಾಸ್ತಿ ಒಂದು ಸ್ಯಾಂಪಲ್. ದೆನ್ ರಿಸೆಪ್ಷನ್ ಇದೆ, ರಿಸೆಪ್ಷನ್ ಒಂದೊಂದು ಸ್ಯಾಂಪಲ್. ದೆನ್ ಹಾಸ್ಪಿಟಲ್ ಬೆಡ್ ಇರ್ತವೆ, ಆ ಬೆಡ್ ಒಂದೊಂದು ಸ್ಯಾಂಪಲ್. ದೆನ್ ಎಲ್ಲಿ ಇಂಜೆಕ್ಷನ್ ಲೋಡ್ ಮಾಡ್ತಾರಲ್ಲ ಅಲ್ಲಿ ಒಂದು ಸ್ಯಾಂಪಲ್. ಸ್ಯಾಂಪಲ್ ಅಂದ್ರೆ ಆ ಸರ್ಫೇಸ್ ನಲ್ಲಿ ಇರುವಂತ ಡಸ್ಟ್, ಅರ್ಥ ಆಯ್ತಾ? ದೆನ್ ವಾರ್ಡ್ ನಲ್ಲಿ IP ವಾರ್ಡ್ ಇದೆ, ಆ IP ವಾರ್ಡ್ ಅಲ್ಲಿ ಡಸ್ಟ್ sample. Then general ward there, adalli kuda ella samples collected. After the collection all the sample for the various types of surface in the hospital, right? That is examined in the lab. Which type of bacteria is there in our hospital? Which type of, right? So because more all the getting the infection in the hospitals, right? So here we have to diagnose. You have what? Diagnose which type of pathogenic microorganism in our hospitals, right? After that, in the hospital, that is a fumigation. Fumigation in the OT, operation theater. Fumigation in the what? Walls. And fumigation and cleanliness in the all of the surface. Like surface, ella yavudu surface contamination agide, all the surface ge ಕ್ಲೀನ್ ಮಾಡಬೇಕು, ರೈಟ್? ದಟ್ ಇಸ್ ಅ ಡಯಾಗ್ನೋಸಿಸ್. ಡಯಾಗ್ನೋಸಿಸ್ ಅಂದ್ರೆ ಕಂಡು ಹಿಡಿಯೋದು, ಏನ್ ಆಗಿದೆ, ಏನ್ ಆಗ್ತಾ ಇದೆ. ಕಂಟ್ರೋಲ್ ಅಂದ್ರೆ ಅದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಯಾವ ತರ ನಾವು ಕಂಟ್ರೋಲ್ ಮಾಡಬಹುದು. ಸೊ ಕಂಟ್ರೋಲ್ ಯಾವ ತರ? ಫಾರ್ ದ ಪ್ರಾಪರ್ ಗೈಡೆನ್ಸ್, ಫಾರ್ ದ ಪ್ರಾಪರ್ ಕ್ಲೀನ್ನೆಸ್, ಫಾರ್ ದ ಪ್ರಾಪರ್ ಮೇಂಟೈನ್ hygienic. That diagnosis ಅಂದ್ರೆ taking the samples and which type of microorganism and in that hospital. That is a diagnosis and what control. Next is a preventions. This that we maintain in hospital, that is a preventable measure. So first is the isolation. Isolation ಅಂದ್ರೆ ಏನು? Separate ward ಮಾಡಬೇಕು. All ward we cannot mix. One separate ward for the female, separate ward for the male, separate ward for the respiratory infection. Corona separation. ನೋಡಿದ್ರೆ ಕೊರೋನಾ ಟೈಮ್ ಏನಾಗುತ್ತೆ? ಐಸೋಲೇಷನ್ ಇಟ್ಟಿರ್ತಾರೆ ಎಲ್ಲರಿಗೆ. ಕೊರೋನಾಗೆ ಸಪರೇಟ್ ವಾರ್ಡ್. ಯಾಕೆ ಅದು ಒಂದು ಜನರಲ್ ಹಾಸ್ಪಿಟಲ್ ಮಾಡಕ್ಕೆ ಯಾಕೆ ಆಗ್ತಿಲ್ಲ? ಯಾಕಂದ್ರೆ ರೆಸ್ಪಿರೇಟರಿ ಟ್ರ್ಯಾಕ್ಟ್ ಇನ್ಫೆಕ್ಷನ್. ಅರ್ಥ ಆಯ್ತಾ? ಅದಕ್ಕೆ ಕೊರೋನಾ ವಾರ್ಡ್ ಇಸ್ ಡಿಫರೆಂಟ್. ಕೊರೋನಾ ಹಾಸ್ಪಿಟಲ್ ಆಲ್ಸೋ ಡಿಫರೆಂಟ್. ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್? So here the separation, the isolation. Isolation ಅಂದ್ರೆ separate. A patient ಗೆ ಯಾರಿಗೆ respiratory tract infection ಇದೆ, who is suffering from the respiratory tract infection, that is separate. Who is suffering from the gastrointestinal disease, that is a separate. Right? Who is suffering from the what? Some another problem, that is a separate. So here separate ward, separate isolation. Understand? That will reduce the time of infection. What? Chance of infection. Separations. Next the hand washing and gloving. Before what handling to the patient, first we have to hand wash. After the handling we have to hand wash. Before and after every procedure hand wash. Second, sometimes we have to use the gloves. What? We have to use the gloves. And also after the procedure, remove the gloves technically. One techniques of the wear. Techniques of wearing, technique of removing. Right? So before wear the gloves, hand wash. After the using the hand wash, both method. Understand? Hand washing one technique there. Then hand wash technique, then gloving technique the infection reduce ಮಾಡಬಹುದು. Then aprons. Aprons use ಮಾಡ್ತಾರೆ ಹಾಸ್ಪಿಟಲ್. ಏನು ಯೂಸ್ ಮಾಡ್ತಾರೆ? ಏನಾದರೂ ಬ್ಲಡ್ ಮೇಲೆ ಬಿದ್ದಿದೆಯಾ, ಸೊ ಏನಾದರೂ ಕಂಟೆಂಪ್ಷನ್ ಇದೆ ಅಂದ್ರೆ ಬೇಗ ವೈಟ್ ಬೇಗ ಕಾಣುತ್ತೆ. We can easily wash that. Understand? ಇವಾಗ ಕಲರ್ ಮೇಲೆ ಏನಾದರೂ contamination ಅಥವಾ cleansing ಮಾಡಿರೋ ನಮ್ಗೆ ಗೊತ್ತಾಗಲ್ಲ. So that's why we use the white aprons. If anything is contaminated present, we have to easily washable that. Understand this one? Next is mitigation. Mitigation is a proper guidance and proper handling. The most effective way of controlling nosocomial infection is the strategically implementing quality assurance, quality control measures to the healthcare sectors, and the evidence-based management can be feasible approach. Strategically what? Strategy maintain ಮಾಡಬೇಕು. 1 week ಆದ್ಮೇಲೆ prevention methods, 1 week ಆದ್ಮೇಲೆ then diagnosis method, then 2 to 3 days ಎಲ್ಲ hospital cleanliness, right? This strategically implement ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ? Hospitals clean ಇರುತ್ತೆ. That is the nosocomial infection in the hospitals, right? These are the types. And some another way of prevention is that administration of antibiotic therapy to the carrier staff or source patient is destroy the pathogenic agent. Sometimes ಏನು ಮಾಡಬೇಕು? Hospital side who are working, they take the first vaccines. Medicine should take the what? Vaccines. For vaccines ತಗೊಂಡ್ಮೇಲೆ hospital work ಆಗಬೇಕು. Without vaccination don't work in the hospital, right? Because accidentally you get the infection, what happen? You suffer. You first take the vaccination, what happens? The chances are what? Less to get infections. Take the proper vaccination, take the antibiotics. Take what? Sometimes antibiotics to destroy the pathogenic agent. Antibiotic solution, so surface मैंने spray, throat spray, then fumigation, so ಅದು ಪ್ರೊಸೀಜರ್ ಇರ್ತವೆ. ಅದಾದ್ಮೇಲೆ ಇನ್ಫೆಕ್ಷನ್ ರೆಡ್ಯೂಸ್ ಮಾಡಬಹುದು. ದೆನ್ ಸ್ಟೆರಿಲೈಸೇಷನ್ ಟೆಕ್ನಿಕ್. ಸ್ಟೆರಿಲೈಸರ್ ಯಾವುದು equipment before use first they clean. Understand? The same way aprons we using that first they clean. Gloves we using every time new gloves. New gloves animal are here usable, right? So that one. Next is like regular washing ಆಯ್ತು. Then use sterile dressing ಕೂಡ in the time of dressing we have to take the sterile dressing pads, not the contaminated, right? These are the some of ways that is the prevention of the nosocomial infection, right? So once again, definition is that infection that occur in the hospital side that we call nosocomial infection. Next, causes of nosocomial infection are two cause. One, it may be the staff, it may be the equipment in the hospital cell, right? It may be the self patients also. Self patients also the one of causes. Second is what? Mode of transmission. How the transmit? Through the contact method. Through the what? Next? Airborne. Next what? Oral. Next what? Parenteral. Okay. After the mode of transmissions, typhoid nosocomial infection first is a UTI. UTI nothing but what?
Urinary tract infection.
Next is what? Respiratory tract infection. Next is what? Next. 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 These are the types of infection in the hospital setting. Next, after that, diagnosis and control. Diagnosis is what? Taking samples of the various surfaces. Taking the sample of the various surface. Diagnose the which type of positive organism is there. First one. Diagnose or control. Control is that frequently use of what? Antiseptic lotions and use of antibiotics. What using of what? Fumigation, right, in the hospital side. That is the infection. Next, after the control, next is the prevention. How to prevent? Through the isolation,
Hand washing,
clothing,
aprons,
then
mitigation.
So these are the methods to act. And after I said some of another way, taking the vaccinations. Taking what? Vaccinations. Then what are using the articles of equipment in the hospital side. So these are the ways that is the preventable measures in the hospital. Okay, all understand? Any doubt? Glad? Next class will